Now I will call Dr. Abdul Rahman from Shaukat Khana Memorial Hospital, Lahore. He did his fellowship in general surgery in 2020 and fellowship in surgical oncology in 2022. Dr. Abdul Rahman. He didn't come. Okay. Sorry for the inconvenience. I will call another person right now. I'm calling Dr. Hina Khan from Dow University Hospital, Karachi. She has an FCPS and FACS. She is consultant general surgeon with special interest in colorectal surgery. She is currently working as an assistant professor in Surgical Unit 5. She is an active member of CDPWA.
आप लगा दीजिए प्रेजेंटेशन
लगा रहे हैं
Bismillahirrahmanirrahim. Assalamu alaikum. Today I am going to discuss about the early onset colorectal cancer. Next. So these are the authors of my study, and there is no conflict of interest regarding the presentation. As far as the global burden is concerned for the early onset cancer, it is, and the colorectal cancer is the third commonest cancer all over the world. Majority of the cases are present in the rectum, followed by the left colon. This is the local data from the Shaukat Khana Hospital, Lahore, which is suggesting that the colorectal cancer is the second commonest colorectal cancer among the 10 malignancies. So the colorectal cancer is divided nowadays in two categories, that is the early onset and the late onset colorectal cancer. Any cancer that is developing before the age of 50 years is called the early onset cancer, which accounts about 10% of the cases. And usually it affects the rectum and the left side of the colon. In one of the study, it is stated that by the end of 2030, there will be 11% of the colonic and 23% of the rectal cancer will occur in the US in young adults. And it has a worse prognosis because it is diagnosed in the delayed as an advanced disease. So these are the different risk factors in these kind of patients, like the Caucasian ethnicity, obesity, hyperlipidemia, male gender, alcohol intake, and the history of colorectal cancer in the first degree relative, sedentary lifestyle, ulcerative colitis, and the hypertension. These are the different factors which can lead to the bad prognosis in the early onset colorectal cancer, like if the microsatellite instability is present, and if there is a family history of colorectal cancer, and these patients are usually present on the left-sided colorectal cancer. Their disease is usually advanced at the time of presentation, and usually the time from the symptoms till the diagnosis is very long. And for the pathology, in these type of patients, the mucinous and the signet variety is very much common. So the objective of my study is that to find out the prevalence of early onset of colorectal cancer, and the rationale was to find out the burden of this disease in the early age group, so that we can standardize the screening program at the national level. It was a retrospective cohort study done at Surgical Unit 1, Civil Hospital, Karachi, from 2018 August to July 2022. We retrieved the data from our national registry software, which was developed by our unit in 2019, and it is web-based software. The statistical analysis was done by the SPSS version 21. So these are the results. There were about 176 patients of early onset colorectal cancer. Among them, 105 were males and 71 were females. The mean age was 30 years and the range was between 16 to 50 years. Majority of the patients presented with the adenocarcinoma, and a large number were, these are the numbers of signet variety. 36 were of signet variety and the 24 were the mucinous. And the rest of these tumors were labeled as just the adenocarcinoma. And there were about 8 patients of squamous cell carcinoma and 3 of neuroendocrine and 1 lymphoma. Majority of the patients were of the rectal and the rectosigmoid junction. As we have discussed earlier as well, that majority of our patients are in the advanced stage, that is T3 and T4. Whenever we operate, usually we get these type of findings in these patients. This is the advanced disease. And these are the pictures of signet variety adenocarcinomas. So the majority of the patients were of poor socioeconomic status, and these are the breakup of the surgeries which we perform, and the large quantity was the diversion stoma, because majority were of advanced stage. So on follow-up, we found that the 16 patients lost the follow-up, and there were 6 patients who expired. 4 were presented with the recurrence, 2 with the hepatic recurrence, and 1 patient with the liver and the peritoneal metastasis, and other one was with the liver and the lung metastasis. So there are multiple studies which has been suggested that now the early onset colorectal cancer is increasing, its incidence is increasing, so the education at the public level is very much important, so that we can educate them about their lifestyle modification, and to advise the young patient to be vigilant for the follow-up, and to present with the symptoms, those alarming features earlier as compared to the delayed presentation. We should, so I want to conclude that the colorectal cancer in the young group is of early onset, but it is diagnosed very late. So the awareness should be done for the early detection. We should do the major work on the research, so that we can identify the quality of life among these type of patients and the surgical outcome properly, and we can form the guidelines for the screening in the young patients, And these are the different challenges which are faced during the management of these early young patients, like the fertility, pregnancy, sexual health, and the financial issues, and the long-term survivorship. Thank you.